Welcome, everyone. Thanks for joining us. It's my pleasure today to welcome Brent Walker, Senior Vice President of Marketing and Analytics at PatientBond. We're going to have a great discussion about everything they're up to. Brent, welcome.
Thanks, Mark. Appreciate it.
Absolutely. Great to have you with us. So you and your colleagues have a really great story to share. Let's begin by finding out all about PatientBond. What is your company all about?
What is our company all about? At its core, PatientBond is a platform for patient engagement, for digital patient engagement. We use email, text messaging, interactive voice response, appless widgets, you name it, a whole variety of digital communication channels. But there are literally thousands of companies out there that do patient engagement. So that's not a big differentiator. Where we differentiate is we infuse something called a psychographic segmentation model into our workflows so that we can personalize all the communications according to the individual patient's motivations and priorities and communication preferences.
Wonderful. Let's talk. Let's drill down a little bit on what psychographics is all about. Explain the concept and how you implement it at PatientBond.
Sure. Psychographics basically pertain to people's attitudes, their values, their lifestyles, and their personalities. It basically makes up who you are, Mark. It's nature and nurture. It's your experience through the first 18 years of your life and whatnot. And because it basically forms your personality. It informs your core motivations and your priorities and your communication preferences. And because of that, there are unique ways to approach you or any other individual patient or say health insurance member out there based on your own unique drivers. And psychographic segmentation is the ability to group people according to those shared characteristics and then target them in a population and then engage the individual with the right messaging, the right channel mix, the right frequency of communication and cadence of communication so that it resonates with you specifically as an individual patient. So it's pretty powerful.
So it's a kind of a customization of typology.
It is, yeah. You think of it as kind of like a healthcare personality that goes beyond typical demographic or socioeconomic or even heart or health condition segmentation, which is pretty standard for the healthcare industry.
Yeah. Now, it has been used in other industries before it really emerged fully into healthcare. How has it been used in other industries?
Oh, yeah. Actually, psychographics go back to the late 60s, early 70s. It's fairly new here in healthcare, but a social scientist, I believe his name was Daniel Yankelovich back in the late 60s, had reasoned that things like demographics, age, ethnicity, gender, income don't have an overwhelming drive on people's motivations. It factors into it because we're all different and there's different physical features that make us different. But some of those underlying motivations were not being explained by typical demographic or socioeconomic variables. So psychographic segmentation was born back then, and other industries have picked it up and run with it very much and adopted that. So for instance, the consumer products industry. Prior to PatientBond, I spent 20 years at Procter Gamble, and they've got more than 20 brands that generate well in excess of $1 billion in revenue a year. And, there's a secret to doing that. There's an art and science to marketing and branding and consumer understanding. But part of that recipe, one of the ingredients is psychographic segmentation, to understand deeply what drives the consumer to make the decisions they do and to activate certain behaviors. So when you see a commercial from a Procter Gamble product on the air, whether you know it or not, there are certain psychographic cues that will pop and resonate for their target audience. That ad may not appeal to everybody, but it doesn't matter because they know their target audience and who's the most likely to purchase that product. And images, words, phraseology, all of that go toward triggering or activating the right behavior. So, P&G is one example of that. When I spent 20 years at P&G, I was actually an executive on loan to Walmart for nearly a year. And I was teaching them about psychographics. I mean, they had a psychographic model on their shoppers, but by overlaying some of the early work that we did previous to PatientBond onto their models, that we can inform their healthcare strategies. And I did the same working with Walgreens and CVS and whatnot. So the consumer products in the retail industry uses this quite a bit. Beyond that, the automotive industry has used it and pioneered quite a bit of this, in the financial industry too, banking, developing financial services and the commercials. Geico for insurance. They're another one. You see all the Geico ads on TV. They're all funny, and it's all about saving 15% in 15 minutes. But there's different approaches to humor in some of the ads, and some of their ads will appeal to you. Other ones will drive you nuts, but it appeals to the psychographic segment that they're actually trying to go for. So this is widely spread across industries, though it's fairly new to healthcare.
And I know it's hard to summarize, but very briefly, what has been learned outside healthcare that we're now thinking about inside healthcare that really had been somewhat foreign to us?
Well, getting beyond kind of this one size fits all approach. I know healthcare is at its heart kind of risk averse, right? I mean, and thank God, as a patient, I'm glad healthcare is risk averse. But as a marketer or a business person, understanding that a one size fits all message that goes through a committee of regulatory and legal people saying, okay, this is all good boilerplate, that's not necessarily going to resonate with everybody. In fact, you look at the healthcare industry, and it's kind of a hierarchical adult to child relationship between the provider and the patient. Do as I say, and you'll get better. And that really, only in our work, we've identified 5 psychographic segments across all the consumers in the United States. And that approach, that kind of directive approach, only works for about 15% of the population. That means 85% of the population, the way the healthcare industry engages them, talks to them, the words they use, the channels they employ, like a one-shot email going out to them, like that's really going to make a massive difference. No, it's not, because people are driven by different propositions, different ways of framing the message. And because we've identified 5 psychographic segments, there's 5 different ways to get your message across, like take your medicine, show up for your appointment, pay your medical bill. So there's an optimized engagement strategy depending on your psychographic profile.
Right. And how do you and your colleagues at PatientBond help patient care organizations customize what they do in this area?
Sure. We can help them identify what their patient or member base looks like in terms of the psychographic makeup. There are several ways of doing that. One, we've got a very brief, takes about a minute survey that people can answer, and it'll identify with 91% confidence what segment a person falls into. We've also got a progressive classifier that only starts at about 3 questions, and you're at 3x greater than chance identifying what segment a person belongs to using that. And you can add questions at different patient touch points along the way. A third way is we've actually worked with national data compilers, like the folks that figure out your credit score. And they've got records on all the adults in the US across the United States, age 18 plus. And what we did was we worked with their data scientists to come up with an algorithm to statistically project our psychographic segments over everybody in the US. So they're kind of pre-segmented. And what we can do then is either identify the segment of your current patient population, identify prospects segments out in the marketplace. We can heat map down to the census block level where there's over and under concentrations of these different segments. And then, our workflows execute messaging, marketing messaging, clinical messaging, RCM messaging to get people to be motivated and activate certain behaviors, like taking your medicine, like I said. But otherwise, we can also consult our customers to help them understand how to speak to each of the psychographic segments, and they can use that information to inform their business strategies or their campaigns. So at our core, we're a platform for patient engagement. We can be a standalone. We can be an enhancement, like a bolt-on to a CRM or an EMR system. And we license our market research data. We do an inordinate amount of market research on an annual basis. to try to figure out the healthcare consumer, what makes them tick, and get all the psychographic insights we need to help our customers meet their business objectives.
Wonderful. What what are some of the biggest challenges that hospitals and health systems have when they approach you that you're helping them with? What is it? The fact you referenced earlier, of course, that one can't do a one size fits all. Is it that healthcare has been pretty poor in terms of being sophisticated in terms of marketing?
It's kind of part of it. Kind of the joke is that healthcare is about 10 to 20 years behind some other industries when it comes to employing consumer science to influence patient behavior. But oftentimes people assume that because they've already invested in certain technologies or systems like CRM or EMR, they're locked into using those systems the way they have been using in the past, because those are hefty investments. And we come in and we say, hey, look, don't throw the baby out with the bathwater. You can continue to use your system. We can inform your system. You don't have to replace it. We can actually enhance the system that you're using. And then, so there's kind of a mental block on using an outside technology, which is easily overcome. And there's that mental block, I guess, to some degree, like you had mentioned, healthcare doing things the way they always have, and it's kind of risk averse, that this is a new approach. Because people are not familiar with different elements of true consumer science and consumer centrism in healthcare, it could be a little bit daunting. So helping them understand, hey, look, this doesn't replace the practice of medicine. We're not going to violate any HIPAA issues or anything like that. What we're going to do is help you look at the situation or the what you're trying to get the consumer to do through the lens of the consumer, and engage them in a way that's going to motivate and activate the desired behaviors.
Okay, and what as organizations work with you, what do they find as they start going into this journey? What is it like?
I think there's a little bit of a wake-up call on some of the results that they see behind something like this. So once you start actually engaging the healthcare consumer or the patient on their own terms and treating them like a human that has certain preferences and desires, the responsiveness is huge. So for instance, we've done things like filling care gaps and getting people to get diabetes screenings and mammography. And when you're sending a collection of emails and text messages versus what we'll call a control group, which is what the customer's typically doing, we've seen anywhere between a 4 and 8 times or 4 and 8x increase in in the response rates among the consumers or the recipients of the messaging. Hospital readmission reduction is a huge area. Like I said, I've been talking about how this is used in marketing, but for clinical applications, we've been able to use this for 30-day hospital readmission reduction to a great degree, specifically in congestive heart failure, COPD, forms of spinal surgery, end-stage renal disease, things like that, where sending them patient education with short surveys to gauge their responses and their recovery once they've been discharged from the hospital, we've actually seen at a minimum about a 50% reduction in hospital readmissions, up to 90%. And it's not removing the human element from all this. I don't want to say that digital is a panacea for everything, Mark. What this does is allows, like taking the readmission reduction example, you still need the nurses, you still need the staff in the call center. From what we've seen in our experience, about 85% of the patients are doing pretty well after they get discharged from the hospital. But the call centers are following up with every single patient and try to reach them with phone calls and whatnot with not high response rates. Well, the system basically focuses in on the 10 to 15% of the people that are going to truly be at high risk for readmission. And we know that by the way they respond to the surveys that are built into our two-way communications. And it alerts the nurses and the call staff on who they need to reach out to, and then intercept them and intervene before too many things happen to have them wind back up in the hospital in the emergency room, and it's worked really, really well. I think what people are, they're surprised to see that once you start to employ this, that there's not a lot of risk involved, because we crossed all those T's and dotted those I's from a IT security standpoint. But just the response rates that we get, and and it's not just digital response rates like openership or click through. That's meaningless, really, at the end game of things. It's the results. How many people are we getting better? How many people are we getting to actually do screenings? How many people are we keeping out of the hospital? Or how many people are we getting through patient acquisition, reactivation, and retention? It's those end measures that make the difference. And I think that's some of the surprise to the people that start working with us.
Well, and what's fascinating is that as they go into these processes, I'm sure they're learning more and more. It's a continuing unfolding, right?
It is, absolutely. It's like, okay, they get it. Once they jump into it, they start to see it and they start to learn about it. And here's the thing, like I said, we've identified 5 distinct psychographic segments in the population. But clinicians and marketers and everybody else, they know who these people are intuitively. What this does, it allows you to send the right message to the right people instead of trying to throw spaghetti against the wall and try to influence them with a whole bunch of different messages. This very much zeroes in on it, and people go, hey, I recognize this segment versus that segment versus that segment. And now what we're doing is say, well, this is what you say. Here's the code book. Here's how you engage that segment so you can really enhance the likelihood that you're going to get them to do the right thing. And people catch on really quick.
That's great. That's great. And so it does become a little bit easier in a sense as they go along using the product, right?
Absolutely. And in fact, we try to drive as much self-sufficiency among our clients as possible. Now, we're a managed service, so we're developing all the outreach and segmentizing all of the communications that are going out. But these insights and the market research that we do to continually feed this can benefit our customers' business and clinical strategies and their campaigns. And we're teaching them along the way. And after a small amount of time, they start to see these patterns and they start to understand how to speak to each one of these segments, and they're employing that. And the more that they do that on their own, and the less they need consulting from us, one, that drives efficiency, so that's always great. But 2, they really understand the power of this, and the broader patient population ends up benefiting from it because they're actually taking a true consumer-centric approach to the patient.
That makes so much sense. What do you see happening in your space in the next few years? How do you see what you're providing and what hospitals and health systems are needing? How is that going to evolve forward? It seems as though consumerism is really finally taking hold in healthcare, partly because of the pandemic and consumers realizing they really do have choice, at least to some extent. So how do you see all of this playing out in the next few years?
Yeah. Psychographic segmentation is new to healthcare. It's been around forever. In healthcare, we're going to get to the same point that we have with retail and consumer products. This is kind of a stepping stone to true personalization. Right now, we use machine learning and AI to always continuously hone our approaches, our model, and our outreach. And we're going to evolve with all the data that we're able to look at from all the market research that we do to all the claims data that our customers have and utilization data. And it's going to get to the point where we can truly personalize on a one-to-one approach exactly what you want, what you need, and in a manner that's going to make it as easy and efficient as possible for you to get the care that you need. We're not there yet. We view this as a stepping stone along that way. And when you're thinking about, when we talk about our vision and mission for being, it's all about the evolution to truly, crafting or at least reinforcing that provider-patient bond, hence our name, PatientBond, so that you're able to, whether in office or remotely or out in the real world, keep that bond, strengthen it, and drive the right behaviors to maximize healthcare as best as possible on a one-to-one basis.
As you and your colleagues are doing this important work, do you see consumers changing at all in the next few years in healthcare?
Consumers, personalities don't change, behaviors change. Okay, so um, people are evolving very, very quickly, especially with technologies. And I mean, if you look at things like virtual care and telehealth, I mean, obviously with COVID, that's ramped up quite a bit. People learn new techniques for taking care of themselves. Their behaviors will evolve along the way. And personal assistance, AI, things, genetic testing, these are all things that consumers are adopting more and more and more. And the one thing that healthcare has to be aware of is look outside the walls of your organization and truly understand, almost like in an ethnographic fashion, how your patients are actually living day by day. Because, are they thinking about their healthcare 100% of the time? No, absolutely not. Are they engaging the healthcare system all the time? No, it's like 2 to 5% of their daily lives when it's all said and done. But you have to understand how they're living their life, and by understanding how they're evolving, we can evolve as an industry to meet their needs and again meet them on their terms, on their priorities.
Right, and I think what I meant, I agree with you. Personalities don't change. I think attitudes might change in some cases, right? So for example, one of the things that hospital and health system leaders really need to think about is the fact that healthcare consumers have become far more aware of convenience as a value to them. There was a time when most people, they might have grumbled, but they would be willing to spend a half day, in effect, to go to the doctor, right? They'd have to drive or maybe take public transit, get to the office, sit there and wait. Inevitably, it would be a long wait, right? You'd arrive, your appointment time was 10 o'clock and then 10:45, they'd come and see you. And that's just becoming less tolerable for many consumers. One of the things that I think is happening is there's a definite threat from the disruptors. So these minute clinics that are being built, in CVS's and the Walmarts and everywhere are going to really compete with the traditional bricks and mortar patient care organizations, because for small, again, minor things, obviously, if you're in a major car crash, you can't go to the CVS, but it's amazing how large the percentage of needs is around simple things like sore throat, cough, cold and flu, very simple, skin abrasions that are simple, that are not medically complex. And I think what will be interesting will be, can hospitals and health systems adjust to that new world where they will be competing with entities that they never even thought were their competitors before. I think that's where I was going with that.
Yeah,
and I'm sure you can help with that.
Yeah, no, in fact, interestingly, one of the 5 segments we've identified is actually responsible for 70% of the population that actually visits those minute clinics once a quarter. So you don't necessarily have to target absolutely everybody in kind of a defensive move against those outlets. If you understand who the prime prospect is and who's using it more frequently, that's a group you might want to contact with more immediate care options. And you mentioned convenience. Yeah, expectations change. But the word convenience alone means very different things to different segments here. One is, I don't want to wait in the waiting room for 30 minutes. Another one is, I want more options. I don't like being directed to one answer. I actually want several solutions so that I can pick from. Others are, I like to just sit in my living room, and if someone can deliver me a solution at home, that's convenience. So, and this is where the nuance of word choice and how different segments interpret certain words becomes so powerful. And if you understand that, then you can meet the consumer on their terms based on the expectations, like you mentioned, and formulate the right campaigns and strategies to deliver what people want.
Right. And in many cases, I'm lucky that I live in the middle of a large metro area with great public transit. Many people must drive for most things, and cities are becoming choked with traffic. So there's that too. That is it going to take me an hour and 15 minutes just to get to a clinic, and then an hour and 15 back? It goes back to the whole: do I really want to spend a half day just to have an appointment? And
Sure.
so I think it's wonderful that organizations are looking to organizations like yours to try to figure out how to manage and work with expectations, and how to analyze wants and needs of consumers.
It's very important. And here's a great chance to bring what's been successful from a methodology standpoint from industries that have pioneered it and really refined it over decades to healthcare, to help healthcare become more consumer centric, especially as we're evolving toward value-based care. It's critical.
Absolutely. Any quick closing thoughts, Brent?
No, I appreciate the opportunity to talk with you and the audience here, and just leave people with the idea that we're not all a one size fits all homogenous group that thinks and acts alike. We're different. We've got to recognize that, and the best engagement strategies take into account the human aspect of it, and you can go a long way tailoring engagement to that individual.
Absolutely. Well, thank you so much for your time and your expertise today, Brent.
Thank you. I appreciate it, Mark.
Absolutely. We really appreciate it. And thank you to you and our audience for viewing this session. This concludes the session, and have a great day, everyone.